No, and DEM has been asking about that for many, many weeks, anticipating that. And basically, the way they do this is they always want to have, enough tests so that if people need them, they can send them down. The result of that is, we had a stockpile, but no one really wanted them for many, many months. As the expiration date was coming, they had already gotten one extension. They had asked, can you do more? Can you do more? They said no. So hopefully they'll answer that, and if anyone wants those, they'll do. At the same time, if they're not accurate, we don't want to be giving people a false sense. But what I've been able to do is the federal government had promised these at-home tests, and they haven't delivered on that. So we said, look, people were asking about this, let's go. So we've acquired 1 million at-home tests. We're going to be sending those first to our nursing homes and long-term care facilities, and then we're going to focus getting those in the hands of our senior population who wants it, so that they're able to just do that and then move on. But at the end of the day, with how the Fed stuff works, it's always a struggle with anything you're doing. I mean, they promised at-home tests last month, didn't deliver. They have been taking away our early treatment. We did get 15,000 additional doses. I had asked for 30, so that's still not what we want, because we want to do more sites for people to be able to get treated. But that's just the reality that we're dealing with here. So I don't know when they're going to provide any type of an answer, but I know people at the Department of Emergency Management have been asking about this since November and have still not been able to get a response.
So, Rick, just one quick follow-up. So, like you said yesterday, this is becoming our new normal, having to get tested and get treated and all sorts of things like Omicron and other potential variants. So, in that sense, what would you do moving forward to prevent this from happening again?
Prevent Omicron from happening?
Prevent stockpiling of COVID tests.
Having a stockpile was the right thing to do. I mean, if we had done the opposite, we would have run out and then had to order as people had done it. We just had a lack of demand that happened in September, October, November. Nobody was requesting them. They would have been used, I think, had we had Omicron then. But you also don't want a situation where you're wasting millions and millions of dollars. And so that's why with the at-home tests, what we're doing 1 million. We're going to see the demand. I think we can do another 1 million. But to have hundreds of millions like the federal government, that could potentially do that. So it's trying to respond to the demand. I think the Omicron was, fortunately, it's much milder, but it's so much more contagious. And so nationwide, you had all these people going to try to get tested. And so that created a crunch on the supply. But we are filling the gap with the at-home tests, and we have those. As soon as we saw the need, we were able to do it. But we also put out new testing guidelines under the Surgeon General, Joe Latipo. And, it's really important. People can do what they want. I mean, we're not doing any type of restriction or whatever, but just going out and testing yourself all the time if you're not sick is very little clinical value to that. And so if you're talking about resources being used, that would be kind of a very low value use of testing. And so what Joe has said and what I agree with is, okay, the top reason to test is if you're symptomatic, particularly if you're high risk, so that you can then determine whether you have COVID. If you do, you get treated. If you're low risk but you're symptomatic, there's value in testing as well, so that you know what you do. A lot of those folks are not going to need treatment for Omicron. They will simply just get over it. Not saying we don't want to offer if you want it, but it's probably not going to be necessary. The lowest value testing is just people who are just kind of going to test to saying, hey, am I sick? Now think about it. Before COVID, did anyone go out and seek testing to determine if they were sick? It's usually you feel like you're sick, and then you get tested to determine what you maybe have come down with. And so this is kind of a new thing where they've been saying just go out and test all the time. And again, you're free to do it, but I think what the DOH guidance from Florida is saying is that is unlikely to yield very much clinical value for you, and it also creates a lot of second-order follow-up problems. It's essentially a lockdown by stealth in the sense of if you test positive but you're not sick or have symptoms, you may have to isolate. They don't even know, the test can't tell you if you're even infectious or not. And these PCR tests, you can test positive for weeks after you've been infected, months even in some cases. And so what happens is blanket testing of healthy people it leads to some kids being not in school. It leads to people not being able to go to work and doing some of these isolation, which may not even be justified. And so I think those guidelines are very sensible. And again, it's not saying people can do what they want to do, but I can tell you to just force healthy people like businesses to do that or whatever. We don't advise that at all. We think that's a mistake. We think people should live their lives. And then if they develop symptoms, you can obviously get a test, and if you're at risk and the treatment would really change the course for you, we obviously want to see that treatment done. But you do have some people that will go out and just test all the time, and that's just not a good use of the resources. So that, I think that brought some good clarity to it. And if you think about it, we really want the testing to be like testing for anything else has been prior to COVID. I mean, that's how you live a normal life, not saying that unless you test negative, you can't live or operate in society. That's not a good road to go down. We've done obviously much better in Florida of being open and letting people make their decisions. There's some parts of the country where you have to show medical papers just to go have a hamburger. And you think yourself, why are you doing that? And they say, oh, well, it'll help stop spread, but it's not. You look at what's happening now. You've had huge increases in a lot of these very restrictive states. And so it has not worked. It's imposed a lot of costs on our society, both in terms of economic and slowing the economy, but really in terms of dividing people by trying to act like if you don't have this, then you shouldn't be able to live your life the way normal people have been able to live for forever. That's wrong. And I think you look what's happened in other parts of the world, the way they treat some of these people, if you don't have this many shots, you go that's not what we want to see. And so we really believe in rationality and in normalcy here, and then provide tools for people to be able to get good clinical outcomes.